So I originally came to this country in 1972 to do my graduate degree in chemical engineering, and after finished my master's degree in mathematical modeling of Delaware River, I was looking for a PhD project, and I had the very good fortune of marrying a very distinguished tumor biologist at NCI, who had developed a tumor with a single artery and a single vein in a rat. And for my PhD, I looked at if you inject the drug into the artery of the tumor, how much will be taken up by the tumor or how much would leave the tumor. And what I found out, most of the drug were bypassing the tumor, like a beltway around the city.
Yeah.
So that raised my curiosity as to why drugs don't go into the tumor. And that's what really got me interested. And then I just kept drifting in that area. But my engineering background helped a lot in trying to address these questions. I think one of the biggest challenges, in my opinion, from a societal point of view, is going to be cost of drugs. The new drugs cost $100,000 to $400,000, and probably going to hear tomorrow to manage the toxicity of these drugs costs another same amount of money. So how do we make these drugs affordable to a very large fraction of people around the world, not just the US? So that's why you saw our work on losartan, which is a drug which costs less than $1 per day, and is hopefully making a difference in one of the most difficult to treat disease, pancreatic cancer. So at least that is going to be, in my opinion, something we as scientists need to think about, and not just be so focused on understanding the mechanism or doing trials with drugs, so I'm sort of keeping an eye on that aspect of the others is going to be how to integrate the insight about tumor microenvironment in the treatment. Cancer field for a long time has been focused on cancer cells, just cancer cells, but the impressive results with immunotherapy have pointed out the value of looking outside the cancer cells. If you really look at it, the biggest difference in patients' life has come from immune therapy. Immune therapy helps 3 to 5 times the number of patients than genomic medicine right now, and it's going to only increase. So, and that happened because we began to look outside cancer cells in the microenvironment. So, in my opinion, the next frontier is going to be incorporating the insight about the tumor microenvironment into treatment of cancer.